last year, 2023, our hospital had 1 million patients.
In 2023, you had.
Total.
Oh my God! That's a very good thing.
Hospital,
Yeah.
hospital.
The hands-on training, and this is possible only in PCTU. Are you allowed into the operation theatres? Have you been to the OT?
Yes.
Everyone?
Yeah.
6.5. That's a really big score. So when you can get IELTS 6.5, then you are good master in English. Your college makes sure that every single student speaks English and understands English, which will be very helpful for Indian students because when they're going to come, they don't know Vietnamese.
Stanford
Stanford
You see that here. You
That
see
is,
that.
that's a
in
dream
San
for every
Francisco.
medical student, sir.
Yeah.
To go to Stanford University is a dream, and the first year student from PCTU went to Stanford University for a training for 4 weeks. The
Yeah.
professor from the Harvard University was taking a class in the first year in PCTU. That is great news. That's what I experience. You guys get it. Thank you so much for the university to give us an opportunity to bring Indian students to Vietnam in Da Nang at PCTU University to do their medical program. And here we are in the hospital, the PCTU hospital, the hospital owned by the university in Da Nang city. And we have students who are studying from the university. I think so you are having from second year, right? So for second year, third year, fourth and sixth year students, all the students are there who are actually they were having the clinical practice in the hospital, and we brought them for a discussion table. I want to know from everybody, why PCTU? Because Vietnam has many medical colleges and you have a public medical school and the private medical schools. PCTU is one of the best private medical school in Vietnam which has its own hospital. I can justify why you choose PCTU, but I want to hear it from your mouth. So why PCTU? Why not any other university?
When I hear that about PCTU, that the most thing that changed my mind to come here is that we can go to the hospital from the first year. Because in Vietnam, public medicine school often give their students the opportunity to the hospital at third or
fourth.
Yeah.
Oh, okay.
Yes.
So PCTU is the only university in Vietnam where you have hands-on training, the clinical training from the first year onwards.
Yeah. And
Okay. So to get into the hospital, what is the basic eligibility PCTU ask you?
in the first semester, we have to learn basic science, and one of the most thing that we must learn before, most important thing that we must learn that nursing. We must learn nursing, and we must practice in the stimulate.
In the simulation labs, you have to
Yeah.
practice in the simulation
And
labs.
we must pass
Pass that.
stimulate that, and then we can go to the hospital. Hospital will will have some CI, some doctors, some staff, some nursing that help us to use our skill on the patient.
On the patients.
Yeah.
Perfect. So you are allowed to use your skill on the patients with the supervision of the
Yeah.
teachers or the seniors of nurse or doctors.
Yeah.
So when you start practicing medicine, you don't feel new, you don't feel nervous
Yeah.
at all. So
Yeah.
you are already in the hospital.
Yeah.
That's the best thing.
Yeah.
That's really great. That's a very good positive feeling for a doctor to become, to practice medicine. That's really good. So can I hear from you, why PCTU, please?
Phan Chau Trinh University, and they are training about medical. And I wonder, this school is really new, and I started to know there, and I see that their material is really good and new,
Okay.
and teacher is really good, and I see they have a lot of opportunity to make me a good doctor. So I decided to join Phan Chau Trinh University.
That's very great. That's
Yeah.
very great. So when you talk about teachers and faculties, how do you feel like that? What is the difference you see from other universities, from PCTU University, in terms of the classes, the curriculum, and the thing? Did you see any difference in that?
A number of students in one class. In other schools, they have a big group.
Okay.
So the teacher cannot focus on you. So they should teach, and you learn or not, they cannot focus on you. But this school, about one class about 30 students. So if you don't understand or misunderstanding, you can ask the teacher, and the teacher is willing to help you.
That's
Yeah.
a good thing.
Yeah.
That's really good. Yeah, that's really good. So can I hear from you? Why PCTU University?
I hear PCTU from my father. He sees a post on website, and I am curious about this school because I see this school has a lot of amenities which equip a lot of modems like laboratories, virtual labs, and depend on that we can experience more before we do exam on the patients. And especially I love the school because we can practice in the first year. Another than public school, we go to the hospital in the third year. Yeah. So it is important for a doctor to practice because if we practice more, we have more level of skill and we make a good diagnosis for the patients.
Correct,
Yeah.
correct.
That also
So that's a most interesting factor, that the practice, the hands-on training is best in PCTU, which is the dream for every medical student, and this is your playground. So you can play really, you can learn everything here. You have your ups and downs, your failures, you learn, you see how patients are treated, how you talk to a patient. In the morning, from morning when I have visited all the departments, I see the students are talking to the patients before looking at the reports or everything. They have this discussion sessions with the patient, so they understand what the patient feels. Can I hear it from you? Why PCTU?
First is the equipment. Equipment in here is so modern, and the second is in the university here class have from 15 to 100 students, but in my school 20 to 30 students.
Okay.
So teacher can focus on.
So when you mentioned about the equipments in the universities, I can see the PCTU universities are with the latest technology, and they have implemented AI and digitalization in their total laboratories and in their learning and teaching process. So they have the best technologies in the campus, both in the laboratories and also in your teaching process, isn't it?
Yeah. In here in PCTU, we have a virtual lab
Okay.
that we use AI and VR to learn anatomy.
Okay.
And another thing that we have 3D printing, that if you learn something like learn a heart, oh wow, this vessel is very hard to remember to memorize. You can come to the
That will help you more to learn.
Yeah.
And you also have a cadaver. You have almost 7 cadavers in the campus for anatomy,
7
for dissection.
Yeah.
So that is very good. I don't see any cadavers in private medical colleges in Vietnam except PCTU. I can tell you. In every private medical college, they do with the plastic things, in the simulation lab or the plastic thing. We have the live, we have cadavers, almost have a dead body thing. And I'm so, yesterday we had an event in the college showing our gratitude for the people who donated the bodies for the students to study. They call them as silent teachers. We call them as silent teachers, and that's really good. So can I hear from you? Why PCTU?
Okay, now make me choose the PCTU is they have so many famous professors.
Correct.
So I want to learn from them so much, and I really admire them. So I choose the PCTU because the professor.
That's very good. So your faculty is really rich. You have one of the best faculties in Vietnam. When I was talking to your honorable chairman, he mentioned that he get the faculties from every part of the world, not only from Vietnam. So you get the best professors in this college to learn. So that's a blessing, isn't it?
I have a story about why, because the first day I come to university, Phan Chau Trinh with my father to meet the president.
Oh, yeah.
Dr. Tung.
Yeah, Dr. Tung.
And
Yeah.
he said one sentence that I remember till now. You see, every single medical student can be taught and training the same way.
Yes.
The same way and the same quality.
Yes.
No one's smarter than no one.
Correct. Every single medical student and should treat every patient in the same way, in the same quality. No one is bigger, no one is smaller.
Yeah.
So that is a basic thing about being a doctor. This is a very important factor. Today, the doctors are more into clinical side. They see a patient, they don't see a patient for more than 10-15 minutes. They get the reports done, they write the medicine, and the patients will not be allowed to ask anything about the medicines too. You have to take it, that's it. So now the empathizing, is the word what she used is the best word. The empathizing is a very important. Talking to a patient and making them comfortable to be treated, to give, while talking, you cure half of the disease. And PCTU gives equal importance both for the clinical part and also about the humanity. So that's something
Yeah.
which is very, very nice about the college. So why PCTU? You are the last year, 6th year student, so you're going to leave the college next year, right?
Yeah.
Yeah.
To me, honestly, Phan Chau Trinh University
Huh.
is a new university to me at that time.
Okay.
Yeah, but I find it the best environment with equipment, faculty, the teacher, and we have group of hospital.
Mm-hmm.
Now it's 8, and I
Eight.
think it will grow in the future.
Yes. Next year it's going to be 9. Yes.
Yeah, and I think if we learn in the group of hospital, we can choose one of them to practice, and practice more makes you will be a best doctor in the future.
That's perfect. That's really good. How is the hospital training in PCTU?
Every day when I come here, we have 2 rounds. The first round, we have to evaluate patient, take finding to my doctor, and then my doctor will check it again, and then I also be there with my doctor. In here, we are split up into one group, one doctor with one student.
Okay, one doctor with one student.
Yeah,
Okay.
like I'm 4th grade and autumn.
You're split into 2 groups.
Yeah,
So how are the timings in the hospital training? At what time you come to the campus, to the hospital, and when you leave the hospital, do you have any time, the schedule?
schedule in 1 year we have 4 months to practice in hospital.
Mm-hmm.
Every single day we practice like as a real doctor.
Mm-hmm. Wow.
Yeah. So from 6:30
Mm-hmm.
because we have to go to hospital before doctor. We have to evaluate.
So from 6:30 in the morning. Oh,
Yeah.
correct.
Then we'll start at 11
Okay.
at the morning, and then we start again at 1:30,
Okay.
and then we stop 4:30.
4:30. So from 6:30 to 4:30 you are available in the hospital. So that's how your training happens. Okay. From which year you will start checking the patients and giving a report? From which year?
Onwards.
Which year on? Third year onwards. So from 3rd year onwards you will be checking the patients and giving a report to the doctor, like a case study or the history of what's the status, and the doctor will come and take the treatments. They will get into the treatments. The college has their own hospitals, 2 hospitals in Da Nang. Have you had a training in the other hospital also?
Here in Da Nang, we have 2 hospital, and is one in here, one in Quang Nam is not far from here, and one is next year is our hospital.
In the campus.
Each hospital around 130 and 300 beds,
Okay.
and as I remember that the last year, 2023, that our hospital have 1 million patients.
In 2023 you had.
In
Oh my
total.
God! In total, in the all 7
Yeah.
hospitals, you have 1 million patients.
Yes.
So in this hospital alone, the hospital where you practice, 2 hospitals, Da Nang and
Yeah.
the 2 hospitals plus the new one is coming inside the
Yeah, yeah.
campus. So in this hospital, I think I heard from morning when I said in gynecology department alone there will be an inpatient and outpatient of 100 per day. Yeah, and in pediatrics they said 100 per day.
Yeah.
And I think so. What will be the patient strength in the hospital, both inpatient and outpatient per day?
Each day we receive about 100 to 120 patients, and that is one of the most thing I love my school.
That's
PCTU.
nice. That's really nice. PCTU gives you so much of hands-on training where I don't feel I'm talking to students. I feel I'm talking to doctors already. So everybody is more experienced about the hospitals and environment. Are you allowed into the operation theatres? Have you been to the OT?
Yes.
Everyone?
Yeah.
Okay, you don't feel. How did you feel for the first time when you went to OT?
We had the limit that one operation just have 1 or 2 students.
Okay.
But everyone had the opportunity.
Everyone has an experience in the OT room, so you are allowed to help the doctors in the OT.
Yeah. In their arm. And the doctor said, hey, can you do the stitches? Maybe. I have learned that, but can you instrument? Okay, just do it. I will stand back to you and
He guided you.
I will guide you.
Okay, you did it.
Yeah, I did it.
That's
And
good. That's good.
After that, when I have the patient with the open wound, he said that okay, you learn it, you can practice it, but I will stay back to you
To guide you.
If
That's
you have any problem, just tell me. I will help you.
That's great. That's great. So this is a beautiful experience in PCTU University where nobody can actually. I've never seen any student sharing so much of clinical experience during the course of their study. In post-graduation, the training what they get in the post-graduation is what they're getting in their undergraduation itself. The hands-on training, and this is possible only in PCTU. I can see that very clearly. So now let's get into the teaching and the faculties. How do you feel? What is the teaching methodology in PCTU? How are the faculties in PCTU? How they teach, and what kind of the methodology they follow, and how they actually address your situations, your doubts, and your clarify it. Can you please explain about the teaching and the faculties in PCTU?
Especially in the first year, we have a chance to study with a foreign teacher, and he is one of my favorite teacher.
From which country he is from?
From the United States.
So you have a teacher from United States of America.
Yeah, that's
Can you
right.
please tell his name?
Yeah, he's Daniel Michel, and he's a family doctor.
Oh, that's great. So what about the teaching hours? How many hours you have lectures in the class? How many hours in a day?
Schedule.
In the schedule, the lecture.
In the morning, about 4 hours,
Mhm.
and in the afternoon, there are also about 4 hours from
So
1:30 to 4:30.
Oh, so you have 8 hours lectures per day. So
Yeah.
morning 4 hours and evening 4 hours, which includes your theory and practicals. Am I right? So how is your teaching methodology? Is it in terms of textbook learning, or do they give you any PPTs to learn? So how they do that?
Our method is team-based learning, TBL. That means that we have a group of students.
Team-based learning, TBL. Okay.
Team-based learning.
Okay.
We have a presentation with the teacher.
Okay, the teacher will tell you which topic is going to teach you the previous day. So you need to do a research on it. You need to learn the basics things before you go to the class. And in the class, he will give you a PPT. He'll teach you in the presentation, PowerPoint presentation. And then he will give you a reference textbooks where you can enhance the knowledge about the subject.
Yes.
And so you need to do your own research. So it's both team-based learning. So you will be having a groups. So
Yeah.
maybe four or five in a group
Yeah.
will share their knowledge, will share their ideas, and they learn together, and then go back to the teacher if you have any doubts or any clarification after the classes.
Yeah.
So the class will also happen, and you can also reach the teacher anytime during if you have any doubts, for example, in
Yes.
anatomy,
Yes.
like forearm or anything. If you have a doubt, are you allowed to go to the teacher's room to
course.
ask anytime
Yes,
the doubts?
of course.
That's all allowed. That's good. That's really beautiful. I see PCTU University actually gives a lot of value, a lot of importance for the research area, which not many universities does. They teach you the subjects, they do the clinical training, it is done. But on the research, PCTU gives a lot of importance about the research. So how are you trained to do the research activities?
Yeah.
The first semester, they have a subject, how to learn research.
Yes.
Okay.
And I'm running three research from my own. Yeah.
Okay.
One for pediatric, one for sleep quality, and one for disease.
I need your help. The second research.
Yeah. That means that we have so many opportunity. And that means that when you have an idea,
Yeah.
every result come from the idea. When you have an idea, you can come to the school, tell your teacher, I have this idea, but I don't know how to make it. That's why.
Isn't that really wonderful? Like you are getting so many opportunities to do your research activities. Otherwise, in other schools they say, okay, you first study your book first and write the exam properly, then you get into the research. So this is the only university, PCTU is the only university I have seen that they encourage students to do research.
Yeah, and that's why I'm running three projects.
That's good.
Yeah, because our teachers always support us.
That's very
And
good.
they are very quality teacher.
I know. Thank you so much. Thanks for your information. So, let us talk about what is the examinations. Yeah. So, how is the examination conducted? Like, how many times in a year you have your exams?
Most of the test is on the multiple choice.
Multiple choice. Okay.
But we have one subject that we don't do. We don't do that.
Okay.
Do you know that one subject is? This is public health.
Public health. Okay.
Yes.
Okay.
The name is community medicine.
Community medicine we
Yeah.
call in India.
Yeah.
Yeah.
I will ask you give the long answer and multiple choice.
It depends upon the teacher.
Yeah.
Okay. Okay.
Some
That's
subjects,
Yeah, some check.
some subjects student will do the test on computer.
Oh, okay.
Yeah.
Both you have online and you
Yeah.
have computer. You have multiple choice. You have a long answers. Both
Yeah.
are available in the examination.
Depends on the teacher.
That's really good. That's good. So let's talk about English language. I was so surprised when I see everybody in PCTU speaking good English, and all the students are speaking really good English. And when you go to the patients, I know the doctors are speaking good English. I really didn't see this in Vietnam, even in Ho Chi Minh City, which is called as a financial capital. But still, I don't see so many people speaking good English. So what made PCTU students to excel in English language? I also heard about to get your degree, you need to. Can you
Yeah.
please explain about
Yeah.
that, please?
If you want to achieve the degree,
Uh-huh.
you must have IELTS 6.5.
6.5. That's a really big score. So when you can get IELTS 6.5, then you are good master in English.
Yeah.
So your college makes sure that every single student speaks English and understand English, which will be very helpful for Indian students, because when they're going to come, they don't know Vietnamese, and when they have the peer group, the friends who can speak good English, that will be very helpful for us too. Thank you so much for
You
that.
don't need to worry about that because last year we have some group of students from England
Oh, you have students from England in the campus. Okay.
and from Hungary.
Hungary.
Yeah.
Okay. Okay.
And they speak English. And they come to this hospital to practice for 1 month.
So students from England and Hungary come to your hospital to practice for 1 month. So,
Yeah.
so language is no more a barrier.
There is no more
In PCTU, PCTU language is not a barrier. So English is like well spoken and broadly spoken from every faculty. I can see every faculty, sir. Yesterday we met so many faculties. We met the doctors here. Everyone speak fluent English. So that's very good.
Yeah. And if you have good enough, if you were good enough, like Vian, she have a scholarship from Taiwan. From research.
Oh, really? So can I know about that place?
Yeah.
That's a beautiful thing.
Yeah.
May I know about that place?
So last semester, the schooling with another university is Taipei University. The one of top medical university in Taiwan. And then I achieved the scholarship when there 2 months
Okay.
and fully scholarship.
So you 100% scholarship.
Yeah.
So how did you get that? What
Then I have to write essays.
essays? You have to.
See-
Did you submit any thesis on that?
The CV, send them to the CV and the letter, motivation letter.
Oh,
Yeah, and I also get their DALs and then they can evaluate me.
that's very good. And we are so happy that the PCTU student has got a scholarship, 100% scholarship from Taiwan. And the PCTU itself, they're giving scholarships for the first year students
Yes.
based on the marks and the community activity and for the essay writing. So they give a scholarship, 100% scholarship, up to 100% scholarship for first year student, for first semester. So I was telling sir, all the scholarship will be taken by Indian students. We train them so hard before they come here. So we do that way. So that's very good. Congratulations.
Yeah.
Really congratulations about it. And now I just want to know about the cadavers and the other laboratories apart from the simulation lab. We understand you have one of the state-of-the-art simulation lab, one of the best simulation labs in the country. What are the facilities available in the campus in these laboratories, and how did that help you?
Anatomy, we will have some model like heart, brain, and respiratory system, digestive system, and the teacher will teach us about theory first, and read about the anatomy, the function of what the height and the function of each organ, and depend on that, they teach them on the model organ like the heart, the brain. So depend on the practice in the model. I remember the theory better. Yes, and combining with the multiple choice test, I remember the knowledge deeply.
Okay,
Yeah.
and you get your you do the dissection in the cadaver also in the
Yeah.
anatomy classes. Okay.
Special thing is we can do on visualization. The teacher tell us about the nerves, the muscle, what they are, and I remember it's more better.
That's great. That's great.
And in the COVID-19 pandemic, our laboratory is one of the most placed sample.
Okay.
Many samples.
Samples.
To
Yeah.
test for COVID-19.
Okay.
And not only that, our staff that have published some innovation
Okay.
for COVID-19 test
Okay.
that has been published in US. Yeah,
Okay.
have published in US.
Oh wow! What your staff has? What it
Yes.
was published in US?
Yeah.
Oh, that's very good. That's really good. Yeah. So you have very good laboratories. I can
Yes.
see when it is published in United States of America, the amount of the infrastructure of your laboratories tells us. It's one of the best infrastructure you have in your laboratories. Next, I want to talk about the multi-speciality hospitals you have. The PCTU is coming up with a multi-speciality hospital in campus, with a 300-bedded multi-speciality hospital in the campus, which is with the high technology and the latest technologies, well equipped, and they are also going to have a lot of AI, artificial intelligence, and it's more. Yesterday when I was in the speech, I included the word called it looks like an Avengers headquarters. So it's more going to be a high technology hospital. And aren't you excited to work in that hospital,
Yes,
isn't it? In August 24th.
I think this is one of the most top-notch hospital.
Top-notch hospital.
Yes.
Oh, correct.
You know what? Because when I was on the second or the third year, I didn't remember, that our chief said that I will bring AI to the medicine. That means that we have a hospital. That means that in Nha Hospital, there is a case that's very rare in Vietnam, and you can learn from that. We can put that on our AI memory database, and the teacher will teach you from that. That means that you can learn everything from our hospital.
Let's talk about the international collaboration. How are you exposed internationally? Like, do you have any teachers or any doctors, professors coming from other university to your college to give you some lectures, guest lectures, CME programs kind of? And are you allowed to go to other country to do rotation or internship? I mean, like yesterday when we had a discussion, we heard about the University of Sydney and the American University. So what is your idea about it? What is your knowledge?
We have a local committee of IFMSA, is International Federation for Medicine Students.
Okay.
That it means that we don't need the school to make our connection. We can go to the other country.
Oh,
Just by us.
just by yourself.
That
Okay.
means that the school will provide the best thing for us, and we can go for the other country like Hungarian, Thailand, or even the United States.
Okay.
Yeah,
Have you ever been to any of these countries? Any of your students or your friends or like anybody? Have they been to these countries for the protection?
Yes.
Okay.
In the first year, we have 4 students that come to the United States for 1 month.
First year.
Yeah, first year.
4 students. They went to United States. Which university they went to?
Stanford University.
Stanford
You
University.
see that?
That's a dream for every medical student, sir.
Yeah.
To go to Stanford University is a dream, and the first year student from PCTU went to Stanford University for a training for 4 weeks.
For 1 month.
1 month, 4 weeks. Yeah, for 1 month. That's a great thing. Yeah, it's a great experience.
No, I mean that I remember
Okay.
from the first year, we have a lesson from professor from Harvard talk about liver.
Okay, you had a lesson from Harvard to talk about liver for the
Yeah.
first year. So you are Harvard University. Whether there was any professor or anybody was taking an online classes to
Yeah, Harvard
Oh.
teach us about the
So you have a lot of online classes going on from the professors of the world, like the best professors in the world, right?
Yeah.
The professor from the Harvard University was taking a class in the first year in PCTU. That is great news. That's what I experienced. You guys get it. That's really good.
Imagine.
That's very good. That's very good. So thank you so much for sharing all these details. Honorable Chairman, your president, said that he's coming up with a stem cell research center, first time in Vietnam in PCTU University.
We must do the research for public health and research. Medicine is not just have the patient, you can cure that, but you must prevent the disease.
Perfect. So this is what these kind of ideas and knowledge are inculcated in the student's mind. It will happen only when you have the best teachers. Only when you have the best faculties, only when you have the best president. We need to give a round of, an applause for all of them, because when they say that medicine is not only, this is what, in fact, in my speech too, sir, I was trying to convey this to everybody, to all my students. I say it is not only studying in the book or reading a book and treating a patient. Research is more important in medicine. 1, to prevent diseases. 2, to get the cure for the diseases. So now today, because of the research, we could save ourselves from COVID.
Yes.
If research was not there and if we couldn't get the vaccine within a year, all the doctors across the world they put all their brains in the finding a vaccine. So that's where we are able to get back to a normal life. Otherwise, it's very difficult. I think so. How far is PCTU encouraging for it?
It's very good. And I'm very proud that I'm a part of PCTU. I'm very proud that I have the opportunity to learn from this school, to grow up from this school, and to become not an excellent doctor, but a good doctor.
You are definitely a good doctor. So, and then let's talk about the museum is coming up in the campus, isn't it? They started. Yeah, please speak something about it.
About the museum of my school it's not a plan anymore. We will build in after the Lunar New Year.
Okay.
It will become complete at June 2024.
Before the hospital, the museum is coming. Right. And isn't it the first time in Vietnam again?
The first medical museum in Vietnam.
In Vietnam, the first medical museum in Vietnam.
Okay.
So you have the first stem cell research center in Vietnam.
Yeah.
You are coming up with the first medical museum in Vietnam.
Yes, sir.
And I can say you are the first private medical college to have a 300-bedded hospital in the campus.
Yeah.
Isn't it? So you are the only private college, if I see. Correct. So you are number 1 in everything. That's great news. So let's talk about your US family. Anybody trying to go to US? You want to go to US? What are the classes? How are they training you? What's the, if you have do you masters outside Vietnam in US? So everybody's dream is to.
So my 2 big dream is to be a doctor and can go to United States. Phan Chau Trinh University has both for me. They have opportunity to help me to do that because of US LME is that exam to be a doctor in the US. And we have training about that with a foreign teacher.
Okay.
Yeah, and they teach me how to do the exam, and we also have an exam to do every week about pediatric, op and gym, and surgery, and we do it every week.
Every week you have a mock exam conducted.
Yeah.
And
We have 2 tests every week.
2 tests every week for USMLE. That's great. And I met a Vietnamese American. She's a professor in the university who trains the students for USMLE classes. So you have the right person in the right job, sir.
Yeah.
You don't compromise on it. If a student wants to do USMLE, you bring a person from US so that they train the student. That's the best thing, isn't it? Yeah. So excited to go to US. So what is your residency matching you're looking up to? Which department you want?
Oh, actually, I want to be a radiologist.
Radiologist? Wow,
Yeah.
that's the best one. That's the best one. So every doctor will depend on your diagnostic. Yeah, that's the best thing. Let's talk about your extracurricular activities in the college. Do you have any clubs? Do you have any sports clubs? Do you have any activities like music and dance and any other things? So how the college encourages you for that?
We have club about sports, badminton, basketball,
Okay, they have a sports club in the campus. Yeah.
tennis. If you want, you can create by yourself own. And then a lot of people have the same.
Okay.
And another one is a club about the medical student association.
Okay.
We connect with another with not other medical student from other country,
Okay.
and we will every single year we will have 2 meetings
Okay.
in Asia Pacific.
Okay.
And last summer I have a train come to a medical student Asia Pacific regional meeting. Then I met a lot of Indian students in there.
In the committee, yeah, we have a committee in India, yes. So you have a club, it's a committee where you have connected with the world medical students and also in Asian Pacific students. You happen to meet a lot of Indian students also. So you can bring them to your college or you can go to their college to do something, maybe a research or some case study or maybe a seminar or whatever. That's beautiful. So you get connected to all the medical students across the world. So you can share your knowledge. For example, any new disease or anything you come across, you want to share that, you can share with the other student in US or in England or in India, China, anywhere you can share your knowledge and you get it. And you make more friends outside the country. So when you want to do your masters in any of these countries, you already have a friend there.
Yeah.
So it will be easier for you to take it further, isn't it? That's good. Making friends is very, very important. Very, very important. I know you're from Da Nang, but there are some students who are from different places. Where do you stay here? How is the food? How do you manage the food and accommodation?
Yeah, around our school we have everything. Everything, supermarket, market, restaurants.
So you have everything around the school. You have your supermarket, restaurants, coffee shops.
Yeah, everything.
Everything to sit and chat with friends.
And our school is not far from the beach, about 3 kilometers.
3 kilometers?
It's
Wow.
very-
So you have a beautiful evening all the time. You can do your running and workouts. That's good.
And our professional, our teacher, we know some of them always running for the beach every morning or take a bike. Every morning, ride a bike, ride a bicycle.
That's good. That's good. So you have a beautiful life in Da Nang, right? You have the beach is beautiful, the city is beautiful.
The weather is beautiful, everything is good.
The infrastructure is very, very good in Da Nang when compared to other cities in Vietnam. I really like the infrastructure. The city is it's a very planned city. The nature is preserved, but still you have a high-tech infrastructure. It's clean. So that's very good in Da Nang. So you have a good life in Da Nang, right? So you have
And if you're still concerned about the community,
yes.
I have so many friends from India in Da Nang.
Oh, so you have a lot of Indian communities. They live in Da Nang.
Yeah, I have friends from the other school near our school.
Okay.
From the India, India, very friend.
I want to ask this general question to everybody. I think so. We are at the end of the session. We almost discussed everything, right? There's nothing left.
Yeah.
So, how are you? Are you excited to have Indian students in the campus? How do you want to welcome them? What do you feel about having Indian students in PCTU?
What about India?
PCTU campus, and I can tell you, India is known for hard work like Vietnam is.
Yeah.
I know Vietnamese work really hard. We are Asians. We are known for hard work. And India has produced the best doctors across the world. We are in the medical profession. India is always. We want to support the university by bringing Indian professors in the campus. Indian medical professors. Okay. Yeah. So you get the. We will speak to Honorable Chairman, the President of the university, to bring the Indian professors in the campus, maybe as a full-time lecturer or at least as a part-time lecturer, kind of a guest lecturer, so that you can share your knowledge. And we will also have. We are trying to come up with a collaboration with one of the best Indian hospitals and the medical colleges with PCTU, so we can take you to our country for internship, like you go to US, or you can come to India for an internship or anything. So we are planning into collaborations, more of those collaborations between India and Vietnam in healthcare industry. So how are you excited now? What do you feel? Let me talk about. I don't need to put the word excitement now. I want to know what I actually feel having Indian students in Vietnam.
When I hear that there is a group of Indian students that come to here, I cannot imagine how today I meet them. I'm very excited.
That's great. That's great. How are you excited about having Indian students in Vietnam?
I'm so my Indian people.
Oh,
Not only about medical terms,
Okay.
not about medical department. It's also about IT, computer science.
Yes.
They're good at that so much.
Yes.
And a lot of Indians leader be a management in a big company in the world. Microsoft.
yes.
I
Google.
Yeah.
Yeah.
So my about Indian people.
That's nice. Very, very nice of you. Please be with them. And now in PCTU, I don't see a language barrier at all. So in any other college, I don't see a language barrier. Everybody speak good English. So it was very wonderful talking with all of you. God bless you all. And may all your dreams come true. And I pray God every day that you will be one of the best doctors. And may your dream come true. Your hard work will pay for you. And you have the best leader. You have the best college. You are in the best environment. Thank God for that every day. Thank you very much. Thank you so much. It was very